So do you believe that pharmacists should take a leadership role in antimicrobial stewardship?
Absolutely, yes. And we're really advocating for that at the RPS, and that fits with our professional belief, but it also fits with the expectations of the NHS and the Chief Medical Officer there, you know, that pharmacists alongside other health professionals have a very important part to play. We would say pharmacists are really best placed to offer test, challenge and expertise into the best use of antibiotics.
Dr. Savio?
Yes, with no doubt I am convinced that the pharmacist has a very important role. He's in the health professional team. He is connected with nurses, he is connected with physicians. We have a dream that soon in 2020 would like that every prescription has come to more information, the data, in order to perform better surveillance and to know which is the diagnosis that is below these indications. We need better tools in order to perform diagnosis and to avoid and to convince the public when the patient does not need an antibiotic and show a proof.
Do you believe that the pharmacist's role in antimicrobial stewardship is adequately covered in their training?
I think there's always more to be done. It's about evolving what we know is very, very good education and training in many places. But I think we've talked earlier about the need to ensure that skills to encourage behaviour change are covered. I'm interested also in the degree to which health professionals learn together to tackle issues such as prescribing safely, best use of antibiotics, their stewardship, and then being able to intervene where there are, you know, sort of spikes or issues. So we know that when health professionals work together around these issues, big impact can occur. So that also begs the question about how pharmacists and others perhaps learn some of this together.
Thank you. Dr. Savio?
Yes, I think that is a variety in the work in terms of a school of pharmacy that needs to more emphasis in training of pharmacists in order to be able to work on behavioral changes, and also in clinical skills in order to assess the illness, minor illness properly, and mainly when, for example, a patient has an infection of upper tract diseases that are not necessary to prescribe or use antimicrobial drugs. So we have to support these countries, these schools of pharmacy that have still not reached the minimum level or standard that is required to cope properly with these situations. And also, even in those places where suitable standards are already in place, we have not have a look to see with satisfaction, because there will always be place to do it better. Mm.
The Global Respiratory Infection Partnership believes that the symptomatic relief in the treatment of uncomplicated upper respiratory tract infections is one of the ways in which we can contain antibiotic resistance. What are your thoughts on this? Helen first and then Eduardo.
It's an enormously important area. We know that pharmacists see such a huge number of patients who have upper respiratory problems and are well placed to offer their expertise to advise on over-the-counter remedies for their symptoms and to advise on ongoing support and perhaps signposting them to other health professionals as well. And of course, using their expertise in medicines, are well placed to advise on a wide range of medicines, but also what might need antibiotics or what might not need antibiotics. And it's that kind of conversation with the public that we know our pharmacists can have and is very effective.
Dr. Savio.
Thank you very much. We think that international organizations have to work together, and we have to have a consistent and aligned objectives and priorities. This is very important if we want to achieve better results. Inappropriate use, but not also inappropriate irrational use, in case of respiratory infections is quite frequent. It has maybe between 80 to 90% of all the prescriptions are inappropriate. So we have a huge area to work and to improve the situation.